Hi, I'm Melissa Gratz. I am a professor at Manchester University's College of Pharmacy. I'm coming to talk to you today about the pharmacy profession and what kind of jobs can be offered in our profession. I'm specifically working in academia as a pharmacist, but there are a lot of different positions that I'll talk about along the way so that you can become familiar with what the pharmacy profession looks like. So in order to be in our pharmacy program, typically you need 2 years of undergrad experience. Some students decide to do 4 years for a full bachelor's degree, but you can apply after getting 2 years of specific courses in order to apply here. At that point, you can go ahead and apply and fill out our application process to get into pharmacy school. So once you get into pharmacy school, you're going to complete a 4-year degree. We have 3 years of classroom curriculum. Following that, you'll have a year of rotations. This is where you'll get clinical experience and be able to see where different pharmacists practice. So once you complete that, you'll get your PharmD degree, and then you can look at a wide variety of positions. I'm going to focus on my position as a pharmacy professor, but I may also talk about some other positions along the way. So for me, my day-to-day experience looks a little bit different every day. I am one of our skills lab professors, and so I teach our 1st through 3rd year students in our pharmacy skills lab. We do a wide variety of things in the lab. You'll learn how to do blood pressure, glucose checks, patient counseling, just to name a few things. Along with that, I also have a practice site at Lutheran Hospital in medication safety. So I am the medication safety pharmacist there. I evaluate errors, along with help with any policy and protocol updates, and I work with a lot of the administration at Lutheran Hospital to make those updates possible. So my typical day can look very different on a day-to-day and also weekly basis. I have a lot of meetings that I attend, a lot of students that I get to work with, so every day is just a little bit different. In terms of dress code, it is professional dress, so I typically am dressed in some sort of sweater in the fall with comfy dress pants and then shoes. If I'm at the hospital and I'm working, or I'm working a shift at the hospital, I may be in scrubs. That is something that you'll see pharmacists in every once in a while. Qualifications that are required for my position: I went to school and got my PharmD, so you need to be a practicing pharmacist to be in the pharmacy academia position that I am in. Along the way, I also got my MBA, so I got my Master's in Business Administration, just because I was also interested in administration. And then following that, I actually completed a residency. This was just a general hospital residency, and I completed that prior to starting here. Since I have been here at Manchester, I went ahead and got my medication safety certificate. So in the world of medication safety, this was something that I got to help differentiate myself and really understand what I'm teaching students, along with help better myself for the patients at Lutheran Hospital. In terms of other positions that are within our organization, we have a lot of different professors that practice in different fields. Specifically, my practice site, like I said, is in medication safety, but we have other professors here who have practice sites in a lot of different areas. We have pharmacists who are in critical care, infectious disease, geriatrics, a lot of different things, helping the Fort Wayne community in a lot of different ways, which is really cool to see. In terms of the other different professions in pharmacy, if you were to complete a PharmD degree, you could become a retail pharmacist. So these are typically our community pharmacists that you're going to see at Walgreens, CVS, Walmart. And so typically those are going to be our pharmacists that are dispensing medications to our inpatient. They may also be giving vaccines. They're also doing a lot of other different things behind the scenes. Another option that you have after completing your PharmD degree would be going into the hospital and being a clinical pharmacist. Clinical pharmacists will typically round on a multidisciplinary team, so this could be with a physician, a PT, a nurse, various people rounding on patients to give the best patient care possible. So you may also see that if you decided to pursue a PharmD degree. Along with that, there's a lot of other areas that pharmacists practice in. Then you may see them in a wide variety of areas. So something that's really cool about my job is that I get to work with patients a lot. If you really like interacting with patients or students and really helping them better their lives, this could be a really cool job for you. Another thing that I get to do a lot is math problems. So there's a lot of math that's involved in pharmacy. So we get to do a lot of math and really go through those problems and help our patients get the best care. So if you like math and you like science and maybe some of the blood and gore of being a physician you don't think would be right for you, pharmacy could be a great career. It's really enjoyable. You get to work with patients a lot. You really get to help give them the best patient care, and you're the medication expert. So it's a really awesome career field to look into. So if you have any questions, please reach out to us at Manchester University's College of Pharmacy, and we would be more than happy to give you more information.